In certain conditions of the lumbar spine vertebrae need to be moved, and they can't be on their own. So sometimes we utilize mobilization techniques that will allow for the natural movements of the lumbar spine to take place. These are comfortable, and they move one segment at a time. Not only do the lumbar vertebrae need to be moved, the soft tissue also has to be moved as well, so that there's proper movement and restoration of that vertebral segment. Looking even further down the chain, the muscles that attach to the spine also have to be flexible and strong. The motions of the hip, knee, and ankle also have to be mobile, free of restriction, and have proper joint motion so that the lumbar spine can move the way that the lumbar spine is supposed to move. So it's an entire chain that has to be corrected sometimes, and not just one segment versus another. Really, we are in 3 dimensions. We're moving in 3 dimensions, and the forces act upon a whole system instead of just one joint. So we have to look at a comprehensive view of the lumbar spine, which involves the entire body. Thanks.